Good morning, PE 101 Strength and Conditioning students. We are now on our 5th lecture. Today we are going to be talking about foundational movement patterns as well as injury prevention and rehabilitation procedures and protocols. What is a foundational movement pattern? In a foundational movement pattern, you can just Google this if you'd like. You might find 6 of them depending on the source. You might find 7 or 8. Today we're going to go over the 8 that I've kind of compiled from a variety of different sources. A foundational movement pattern is something that you're going to find as far as what you're doing in your activities of daily life. Okay, so the way that this is going to work is I'm going to read through the 8, then I'm going to give you a physical activity, something that you do in your normal life, as well as an exercise that can help you build on these foundational movement patterns for muscular strength, hypertrophy, and endurance, as well as what you can do for aerobic conditioning for some of these. We have push, pull, lunge, hinge, squat, carry, gait, and rotation or anti-rotation. Let's use the grocery store, going to Costco as our analogy in our story today. So we are pushing our cart. That's an isometric push that whole time. If you are pushing open the door to go outside, that's a push as well. This can be a bilateral movement or a unilateral movement. Pulling. In the Costco aisle, you're going to try to get that bag of rice from the bottom. You have to do a combination of a couple of different movements. You're going to be pulling with your upper body using your lats, your latissimus dorsi that we talked about in our last lecture, as well as we'll probably be combining either a hinge from the hips or a squat using your quads or some variation of a lunge. Let's say we are going to the grocery store, we're driving to the grocery store and we need to back out of our driveway. We have to rotate with our cervical and thoracic and make sure that we're not hitting anybody or anything behind us when we're backing up the car. That is an example in everyday life, as well as carrying things. We do this all the time. You are all students, you have a backpack, you're carrying this on your back. If you're carrying groceries, you're carrying them in your hands like this. There are exercises we can do such as farmer's walks or suitcase carries. Gait is the fancy word for the study of walking and how we walk. Walking is a bipedal movement that we do in our sagittal plane, and that is also one of the foundational movement patterns. So now that you've talked about a little bit the physical activities that can go for each one of these, such as pushing the cart, pulling open a door, lunging to tie your shoe, hinging and pulling with your upper body to get the bag of rice, squatting, let's say when you're putting away all of the groceries and you have to put away them on the bottom shelf of the pantry, rotation when you're driving a car and you didn't look backwards, carrying all the groceries, as well as walking to and from each aisle when you're in the grocery store. We can talk now about the exercises that are associated with these foundational movement patterns. And again, think of them as like a Venn diagram. There's not a black and white answer on any of these. You combine a lot of these in exercises and physical activities. You can look towards our hip flow for almost every single one of these foundational movement patterns. So for pushing, we can talk about push-ups are the most classic example of this, but we can do isometric pushes as well, such as we're holding our plank position, using our triceps and shoulders and core to hold that positioning. Pulling exercises. If you have a pull-up bar at home, you can do pull-ups. The exercises that you're going to do today, which is a Superman hold or superhero hold, and you're going to be pulling apart a towel to turn on these back muscles, the lats and the rhomboids and the rear delts. So we can isometrically pull that way and pull it towards our sternum and our shoulder area, and that'll be a dynamic pulling motion that'll also work the lats. For lunging, you can do forward lunges, you can do reverse lunges, you can do lunges with the rotation, which you'll be doing in your workout today. For hinging, our classic definition of the hip hinge is a deadlift, a conventional deadlift or a Romanian style deadlift where you sit your hips as far back as possible and really are just building tension in the hamstrings and glutes, not much bend in the knee. Our squat, we do this every single workout almost, especially we're doing this at the end of our hip flow to make sure that we're all nice and warmed up for all the movements that we're going to be completing that day. For carrying, we can go into our farmer's carries or suitcase carries. So a ruck would be a form of this as an exercise. So those are the 8 foundational movement patterns, and now we're going to be talking about injury prevention, as well as what we do in our workouts that help already prevent injuries, as well as what happens when you do get injured. What do we do for injury prevention already? We do our general warm-up. Our general warm-up is important for a plethora of reasons, but what we've talked about in the past is 1, it increases your core temperature, 2, blood flow globally, as well as increases our elasticity in our muscles and ensures that we are ready for our workout that day. We haven't talked too much about a specific warm-up. One of your tests for the beginning of the quarter, or let's say if I was to change it for the end of the quarter, and you're to do 100 burpees for time. You better believe that I'm going to warm up a little more than doing my 60 seconds of aerobic activity and my hip flow. I'm going to be completing probably a few more burpees to make sure that I'm getting the routine of those burpees. Probably warm up my wrists a little bit more because it's going to be taking a little bit of load and a little bit of stress being in that position for 100 burpees. And I might do a little bit more aerobic activity to get my heart rate up and ready to rock and roll, as well as the psychological aspect of a specific warm-up. You're not only using your motor neurons to fire in those specific areas, your chest, your quads, your hamstrings, your glutes, but you are psychologically preparing yourself for that specific workout by doing a specific warm-up. So now let's talk about what happens when you actually do get hurt. It is something that inevitably happens, maybe not necessarily because of your strength training regimen or your workouts in this class, but maybe you have played a sport in the past, you sprained your ankle during a basketball game, or let's say maybe not a sport and you were just walking to class, you tripped on a brick in Red Square. There's a big difference between hurting during a workout and being injured because of the workout. If you're hurting during your workout, let's say, and you're doing 100 burpees for time, of course, your aerobic capacity is going to be tested and your lungs are going to be hurting. If you have asthma, yes, this is a completely different story. But if you're hurting during your workout and by the end of your workout you are completely taxed, and after the workout you're feeling better and you're recovering, okay, that is a sign that you're pushing yourself in your workout, and that's a good thing. If we are injured during our workout, and let's say we pull a quad during our burpees while we were doing our jump, and you are still doing your burpees and you're maybe 50 burpees in and you have a pain in your leg in a specific spot that's sharp, and then by 60 burpees it becomes more, and then 70 burpees it's worse, and 80 burpees it's worse, and by 100 burpees it's so bad that you can barely move your leg, and then a day later it hurts more, and then 2 days later it hurts more. This would be considered an injury. When you are hurting during your workout where there's metabolites and waste products being built up in the specific areas that you're working out, yeah, that's going to happen naturally, and that's okay. We want to push ourselves in a good way, but we don't want to push past the pain that's being produced and result in an injury. So when we are talking about pain, we are okay with some sort of discomfort, but we don't want it to be prolonging our recovery and making it so that we aren't able to work out for the rest of the week. No pain, no gain is an old saying, and there's some truth to it, but it shouldn't be the only thing that you're listening to. We've sprained our ankle now, and there are 2 acronyms that we need to talk about. The first one you may have heard in the past, it's called RICE, and the second one has been popping up a lot more in the kinesiology science world right now, and it's called MEAT. So RICE stands for rest, ice, compression, and elevation. MEAT stands for movement, exercise, analgesics, and treatment. I think a lot of this should be based on a continuum. We don't want to put these as black and white, one is better than the other. I think we should be using these in conjunction with each other. All the procedures in RICE essentially are to reduce inflammation and promote rest. Rest is important, especially in the acute phase of an injury. An acute phase of an injury is going to be within 72 hours. There's an importance of resting in that first 72 hours in that acute phase of injury, as well as icing. The idea behind ice is to reduce that inflammation again, reduce edema, which is swelling, and reduce bruising. That's what ice does. The other cool component of ice is for pain modulation. Icing definitely has a pain reduction associated with it. It numbs the area. The important part of compression that I think people forget is in regards to structural support. I think of an example of myself about 1.5 years ago when I had torn my groin and I had an ACE bandage. And I used that spica roll to essentially keep me in adduction more so and added some structural support. It's the same way that we talk about ankle sprains, and we're trying to keep that ankle in that stable position. Elevation also reduces blood flow to an area and helps with the inflammation of the joint, muscle, tendon, or ligament. Let's say now I've torn my groin and a few days later I can move it without too much or significant pain. Maybe it's hurting a little bit on the pain spectrum, but I can move it, and I am starting to move it in certain ranges of motion, okay? Movement is good because now we want to promote blood flow. Once we have elicited some movement in an injury in a specific part of their body, in a muscle that has been injured, we can move now towards exercise. Specific exercises are important for those muscles to not only move but become stronger. And this all goes into the T portion, the treatment. When you go to a physical therapist, a medical doctor, some type of medical professional, they are licensed to treat you for that specific injury. I am not a medical provider. I'm not a licensed doctor of physical therapy. I will always try to refer you when I can to somebody that is a medical provider so that they can give you the proper treatment that they prescribe. I skipped over analgesics. Analgesics are painkillers. The big difference here between painkillers and NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. That'd be something like ibuprofen. That is, again, for that purpose of rice, this would be used in that acronym. An ibuprofen would be an anti-inflammatory, so we're trying to reduce inflammation. An analgesic would be something like Tylenol. Tylenol is not an NSAID, but it does have pain-killing properties. So that's the difference between rice and meat. I think that you should have rice with your meat and not think of these as separate activities or separate meals. We should have them in conjunction with each other and be able to utilize both in injury prevention and injury protocols. Okay, we're gonna take a brief aside here and talk about pain neuroscience. I'm going to speak just a little bit about pain thresholds and why it's important to know what pain is and how you can deal with it. So on the left side, we have a healthy individual, okay? On B, not to say that they're not a healthy individual, but they just sprained their ankle, okay? So they have a little bit more sensitivity. Pain here is on the y-axis, and then time is on the x-axis. So we can have our healthy individual that has not sprained their ankle right here, and the person that has sprained their ankle on those red bricks in red square right over here. Let's say right here, this is your threshold for pain to actually become a significant source and you to register that in your brain. So all of these right here are little spikes. But what's important to know here are the factors that influence pain and why everyone's pain is their own, and you cannot say that somebody should experience pain and someone shouldn't, okay? There are so many different factors. I've listed a few here. Age is one. As you get older, you tend to notice that pain more. Fatigue is another. As you become more tired, pain becomes more apparent, and that threshold starts to go down. Genetics are another factor, as well as physical history. If I'm a Navy SEAL, you better believe I'm not going to have the same pain threshold after going through BUDS than a 13-year-old boy who's just started PE 101. Lastly, another example would be anxiety and stress and coping mechanisms. If you do not have proper coping mechanisms, your anxiety is going to be increasing. As an anxiety and stress goes up, or physical stress and mental stress and emotional stress, your pain threshold will go down. For your first workout today, we're going to be doing something new called a chipper. The idea behind a chipper is that you're going to be chipping away at a lot of repetitions and then going all the way down to 10 repetitions. It's something from the CrossFit world, and we start at 100 and then we're going to end at 10. So for your 100 repetitions of something, we're going to be doing jumping jacks in a little bit of a different variation. Your typical jumping jacks stay in your frontal plane, but for this jumping jacks, I would start with your feet going like this, and then you're going to move your hands in the frontal plane So you're going to be moving in multiple planes, and it's a lot harder than it looks. So let's try this out, and you're going to be getting 100 repetitions on each side. So it's really 200. And then we're going to be moving to 80 high knees. Again, 80 high knees on each side. So with this, you're going to be getting your carry out of the way, because we're going to be trying to complete all the foundational movement patterns in these next two workouts. So you can carry a dumbbell. This is 20 pounds. You can do anything from 5 pounds. You can grab a couple soup cans. You can grab a backpack. And you're just going to be doing your high knees. 1, 2, 3, 4, 5, 6, 7, 8. All the way to 160. Or you can do a double count and try to get to 80. So for your 60 repetitions, I'm going to actually use my chipper as an example here. So for your 60 repetitions, you're going to be doing a squat and a press. And you can use a broomstick for this, a PVC pipe. I got my little golf club right here. Squat and a press is also called a thruster in the CrossFit world. And the idea is that you're going to squat down to a comfortable range of motion where your toes and heels are still on the ground, torso is still upright, and come up. And as soon as you reach full extension with the legs, you're pressing to the ceiling, head comes forward through the window, and your arms are nice and extended, punching through the ceiling. So a few reps, it'll look like this. Legs stay open, hips stay wide. And you're going to be getting 60 of these. If you'd like to, you can use a dumbbell as well, or a barbell, if you have it. For your 40 lunges, we're going to use lunging and rotation now. Again, you can use weight if you'd like, but the idea is that you're going to be lunging forward and rotating over the front leg. When you do your rotation, think about belly button forward the whole time and rotating from the belly button up. So thoracic and cervical rotation rather than lumbar. All right? So you're going to be getting 40 lunges and rotations each side. For your 20, you're going to be doing HR push-ups. HR stands for hand release push-ups. You can increase the range of motion by doing it on a couch. You can decrease the range of motion by doing it with some pillows. You're trying to push your elbows back and retract the shoulder blades and pinch back the shoulder blades the whole time when your hands come off the deck, like so. You can do the same thing on your toes. We've done push-ups enough. The only thing different here is hands are coming off and we're exploding through the floor. For the last portion of the chipper, you're going to be doing 10 burpees. I don't think I need to demonstrate these anymore. The idea with these is you're just ending with something that is going to be difficult. Try to get through these as fast as you can and make sure you record your time for this whole entire workout, from all the way down from 100 to 10. Okay, for your second workout, this is going to be a 12-minute AMRAP, as many rounds as possible and as many reps as possible. You're going to be needing a towel, and that's about it. So, your superhero hold is going to look like this. Glutes are on, heels are together. You can keep your head down. You don't want to strain your neck. And then you're going to pull your towel apart and trying to, again, pinch the shoulder blades back. And then you're pulling to your sternum, shoulder area. Sternum to shoulder area here. You're going to get 20 repetitions of this. And again, we're not getting tall here. This is going to be a lot of extension in the back. We're trying to get long here, okay? Just getting longer. You're getting 20 repetitions here. Drop your towel. Then conveniently, all you need to do is move into your tabletop bird dog position, and you'll be getting 10 bird dogs each side. We've done these in the past as well. Then you'll be doing 5 downward dog push-ups. This is going to load the shoulders and triceps, take a little bit of load off the chest. I'm going to try to demonstrate these from this view. You're going to now, instead of going from downward dog or bird dog position, curl your toes down, anchor them into the floor, and then move into your downward dog. And then elbows go back, sending my head down to the floor. If you can, tap the ground, and then press. It's a lot of shoulders, it's a lot of triceps. And you'll be getting 5 of these. If this is too difficult, again, use a pillow. Alright? I can do the same thing with a pillow. Come all the way down. Hips are still high. Then press.
If this is really difficult, and you can't get any range of motion without feeling a lot of strain in the shoulder, or if it's just strength-wise too demanding, hang out here and get 5 good breaths. Maybe isometrically you can hang out right here, get 5 breaths. All we're doing is trying to strengthen positions that we're not normally used to and load the shoulders and triceps. Okay, after your 5 downward dog push-ups, then you'll go into 5 inchworms. This might come out of frame, you might not see my top half, but I'm doing that hip hinge here and then walking it into a push-up position, getting a breath, then walking my hands back, and then coming all the way back up. Hip hinge to inchworm. And you'll be getting 5 of these as well. In summary, this workout is going to be 12 minutes long, doing a superhero hold plus 20 towel pull-aparts and rows to yourself, and then 10 bird dogs on each side, 5 downward dog push-ups, and then 5 inchworms. And make sure you are recording this and listing it in your summary portion of your assignment. Thank you all for being exceptional students. I appreciate the effort and the commitment to this class during this time. I also want to say thank you for providing good insight into your comments and your submissions online. The more that you put, the better. I've never taught this class online before, so I really appreciate all the honest feedback that you are giving me. It'll only help you as well as future students for this class, as well as make me a better instructor. Thank you all. I'll see you next week.